Well, hello and welcome to Sunday Morning with Coffee uh, with Dr. Childress. And this is a redo. I had a little technical glitch on my prior effort to record. The sound apparently wasn't coming across or something. I don't know. So I'm going to talk again about the patterns of the pathology in the family courts. Um, Diagnosis isn't just simply about specific symptom features and matching those up. It's a pattern match of criteria to symptoms, but it's actually looking at the entire picture and seeing what the pathology is. And the criteria are just ways of sort of simply differentiating one pattern from another. So, diagnosis is a pattern match of symptoms to the diagnostic criteria. Each pathology has its own patterns. So, ADHD will have its spectrum of patterns. Trauma pathology will have its spectrum. Eating disorders or autism will have their spectrums of patterns associated with them. And being competent in any particular pathology is knowing all the different patterns that are associated with that type of pathology. And trauma in particular, as a type of pathology, it replicates patterns. That's what trauma does as a pathology. So it is very much a pathology of patterns. The professional level names for patterns are varied depending upon where you are talking from. Aaron Beck, who is the grand high kahuna of CBT. Aaron Beck is the C of CBT, cognitive behavioral therapy. B.F. Skinner is the behavioral one. But Aaron Beck calls them schemas, these patterns that we have that kind of form our perceptions. John Bowlby, grand high kahuna of attachment, calls these patterns internal working models of attachment. And then Sigmund Freud, the first one in, recognized them as and called them the transference, the transfer of childhood trauma patterns to the current analytic relationship. And so that was the transference on that. And here's what Beck's his definition of schemas. So the evaluation of the particular demands of a situation precedes and triggers the adaptive or maladaptive strategy. So first we kind of come in and evaluate what's going on before we act. And so how a situation is evaluated depends in part, at least, on the relevant underlying beliefs. And that these beliefs are embedded in more or less stable structures called schemas that select and synthesize incoming information. So it's our experiences form our belief systems, and it's our belief systems that then influence how we see and interpret the world. Piaget called it assimilation of information and then accommodation to the information. So we're both acquiring information, but we're also kind of putting it into our pre-established boxes of our schemas and our patterns. Bowlby uh, refers to them as internal working models. And he says that no variable, it is held, have more far reaching effects on personality development than have a child's experiences with his family, for starting during the first months of his relationships with his mother figure and extending throughout the years of childhood and adolescence in relationship with both parents. He builds up working models for how attachment figures are likely to behave towards him in any of a variety of situations. And on those models are based all of his expectations and therefore all of his plans for the rest of his life. And as we start here, I just want to kind of get a handle on definitions here. That in translating professional speak into common speak, diagnosis means the same thing as identify. And pathology means the same thing as problem. Treatment means the same thing as fix it. So we must first diagnose what the pathology is before we know how to treat it. We must first identify what the problem is before we know how to fix it. So you can use all those around. And it's particularly helpful as we go through this, and I refer to pathology, you can just translate that over into problem. And so the pathological parent becomes the problematic parent, things like that. Um, Now, in understanding diagnosis and diagnostic criteria, the diagnostic criteria, the specific symptoms for any pathology, are like the stars in a constellation. So you can recognize the particular constellation, the particular pathology, by a few individual stars. However, the constellation actually represents a picture. So there's actually a bigger picture, and it's just those couple of stars identify the pattern, but are not the actual picture. So the diagnostic indicators or criteria are single symptoms, like single stars needed to identify which pattern we're talking about. The pathology is actually the entire picture made by the pattern. So, for example, the three diagnostic indicators of pathogenic parenting that I describe in Foundations are the three single stars that will identify the constellation as the shared delusion factitious disorder pathology. And then the 12 associated clinical signs are like all those other stars associated with the constellation as well. So today I'm going to be talking about 5 different patterns that the pathology in the family court manifests or displays. Trauma patterns from the transgenerational transmission of trauma. Those are sort of the core patterns that give rise to everything else. The diagnostic patterns having to do with the persecutory delusion and the factitious disorder. The family systems patterns, the cross-generational coalition, triangulation, the personality disorder patterns, the narcissistic borderline dark personality, and the attachment patterns, the false or factitious attachment pathology that's being displayed. And with this pathology, with any pathology, no matter how you look at it, it remains the same thing. And so that's how we have confidence in our diagnosis, is because I can turn it over and look at it from multiple directions, and it always is this consistent problem, a consistent pathology that I'm looking at. So let's start with the trauma uh, pattern, the trauma reenactment. And so classically, the trauma pattern is abusive parent, victimized child, protective parent. That's your classic trauma pattern. And that's what this pathology mimics. So, kind of like those animals in the animal kingdom that mimic other animals, that's what's happening here. We have a false pathology, an artificially created pathology being presented for secondary gain to the pathological parent. Just like the animal gets secondary gain from mimicking a predator, well, this parent's getting secondary gain from creating a false pathology. And it's this false trauma pattern: abusive parent, victimized child, protective parent. And actually, the, the pattern is actually from their core or from their unresolved childhood. So the trauma pattern is actually from their experience as a child of abusive parent, victimized child, protective parent. And then when they get activated in the current situation, reality right now is just parent, child, parent. There's no abusive parent, there's no victimized child, and they're not a protective parent. There's no need. It's just parent, child, parent. But from their own schemas, from their own by perception, the distorted perception from their unresolved trauma, they are adding those qualifiers. They are adding those adjectives: abusive parent, victimized child, protective parent. And the key one is the victimized child. The moment they get the child to believe that the child's being victimized and presents as, oh, I'm a victimized child, that automatically defines the targeted parent as being the abusive parent, because we have to have an abusive parent if we have a victimized child, right? And then the allied parent can swoop in as the protective parent, supposedly, and fulfill that role in their own psychological stuff going on and recreate that false pattern. The key to creating that false pattern is getting the child to believe they're a victimized child, and then everything else falls into place. So here's from Bessel van der Kolk regarding the reenactment of trauma. Now, this stuff is established knowledge. This is from like some of the top experts in professional psychology. So we know this stuff. It's not in the family courts as knowledge because forensic psychologists are ignorant like a rock. They make stuff up instead of like applying knowledge, or instead of knowing the knowledge to apply. So here's what Bessel van der Kolk says, that victims of trauma respond to contemporary stimuli as if the trauma had returned, without conscious awareness that the past injury rather than the current stress is the basis for their physiological emergency responses. So basically, when the divorce happens, that triggers them into their attachment networks, the separation, abandonment things in the divorce. It triggers their attachment networks. And along with that comes that triggering that unresolved trauma that's still within their networks in that pattern: abusive parent, victimized child, protective parent. And so that gets triggered as well. And they don't realize that their anxiety in the current situation is actually part of the past anxiety coming up. And so the past anxiety about abandonment and rejection and stuff gets activated, and they don't realize that their current responding is actually to emotions coming from being triggered from the past. And so this hyper arousal interferes with their ability to make calm and rational assessments and prevents resolution and integration of the trauma. So it's distorting their thinking and perception about current situations. Notice is title of this too for van der Kolk, the compulsion to repeat trauma. We know that's what happens with trauma. We replicate it with some adjustments to kind of work through our trauma. So we make a little corrective changes to the reenactment narrative that's important for this pathology. So Bessel goes on to say that when trauma fails to be integrated into the totality of the person's life experiences, the victim remains fixated on the trauma. Despite avoidance of emotional involvement, the traumatic memories cannot be avoided. And even when pushed out of waking consciousness, they come back in the form of reenactments, nightmares, or feelings related to the trauma. And reoccurrences may occur or may continue throughout life during periods of stress. Well, divorce is during a period of stress. And so, boom, the attachments activates, the trauma experience activates, the anxiety around all of that activates, and they begin to, and their perception of the current situation becomes distorted, and becomes distorted by this false belief that they and the child are being malevolently treated in some way. And it's the child who they believe is being malevolently treated in some way, and they need to come and protect the child. And that's the diagnostic pattern that's associated with this pathology. So now Perlman and Cortese, and take a look at the title and the journal for this. So the title here is Clinical Applications of Attachment. So it's talking about the clinical, talking about attachment pathology in the treatment of complex trauma. So we're talking treatment, attachment, and it's in the Journal of Traumatic Stress. So this is a real journal of real stuff, not a court-involved thing. So here's what they say. Reenactments of the traumatic past are common in the treatment of this population and frequently represent either explicit or coded repetitions of the unprocessed trauma in an attempt at mastery. That is exactly what's happening. Reenactments can be expressed psychologically, relationally, yes, and somatically, and may occur with conscious intent or little awareness. They go on to say the primary transference countertransference dynamic involves reenactment of the familiar roles of victim, perpetrator, rescuer. There you have victimized child, abusive parent, protective parent. Now, there's also a fourth role, bystander, that's filled by the forensic psychologists in the court and teachers and stuff. Oftentimes, that's called in clinical practice out in the field, that's called the betrayer role, because that's the role that should protect but doesn't. And so that's the bystander role. I'll talk about that going forward. But you can see that pattern there: victimized child, abusive parent, protective parent. And they reenact those roles in the therapy relationship. That the therapist and client will play out those roles, often in complementary fashion with one another, as they relive various aspects of the client's early attachment relationships. That's what's happening here, except it's not happening in the therapist relationship. It's happening in vivo with the family, in the family relationships. Is there we are reenacting that childhood pattern that's in the brain, in the schemas, the attachment networks of the pathological parent. So now let's talk about the diagnostic pattern that arises off of that. And the diagnostic pattern, the persecutory delusion, is on that victimized child role. So in order to create this whole reenactment narrative, this whole false kabuki theater, the factitious attachment pathology, all the pathological parent needs to do is get the child to believe the child is being victimized somehow. Because the moment the child presents to others in the victimized child role, that automatically defines the targeted parent as abusive, whether they are or not. It doesn't matter. I've got a victimized child. I must have an abusive parent, right? And that's a targeted parent who the child's rejecting is the main focus of that. And everybody moves off on this false attachment pathology. But creating that false belief in victimization, that the child is being malevolently treated in some way, that is the persecutory delusion. And it's an induced persecutory delusion. It's a shared persecutory delusion. So right there, that's the origins of that symptom. And so here's from the definition of a persecutory delusion from the American Psychiatric Association. Persecutory type: delusions that the person or someone to whom the person is close is being malevolently treated in some way. So you Google malevolent, it's having or showing a wish to do evil. Walters and Friedlander, journal, Family Court Review. This is a forensic journal. This is not new information. This is information that everybody, all the mental health people in the family court should know. So Walters and Friedlander, in some RRD families, resist refuse dynamic, that's one of their made up ones, a parent's underlying encapsulated delusion about the other parent is at the root of the intractability. An encapsulated delusion is a fixed, circumscribed belief that persists over time and is not altered by evidence of the inaccuracy of the belief. It's a fixed and false belief maintained despite contrary evidence. That's how it's described throughout everywhere. It's not, you don't have to worry about plagiarism on that. It's a fixed and false belief maintained despite contrary evidence. And the Walters and Friedlander go on to say, when alienation is a predominant factor in RRD, this stuff, they make stuff up all the time. When alienation is a predominant factor, the theme of the favored parent's fixed delusion often is that the rejected parent is sexually, physically, and or emotionally abusing the child. The child may come to share the parent's encapsulated delusion and to regard the beliefs as his or her own. There's your shared persecutory delusion, induced persecutory delusion. So all mental health professionals working in the family courts should know this. And so they all need to be competent in the delusion, in the diagnostic assessment of delusional thought disorders, and they all need to be conducting a proper assessment for this possibility. The only cause of severe attachment pathology is child abuse range parenting by one parent or the other. Either the allied parent or either the targeted parent is creating the child's pathology, a two-person attribution of causality. They're abusing the child in some way, causing that. Or it's a three-person, a triangle, and it's the allied parent who's creating the shared persecutory delusion, factitious attachment pathology for secondary gain to the parent. That's child psychological abuse. So we either have abuse from one parent or the other when you're looking at severe attachment pathology like this. And so in all cases of court involved custody conflict involving severe attachment pathology, we need to be doing a proper risk assessment for child abuse to the appropriate differential diagnoses for each parent. Okay, is the targeted parent abusing the child? If so, how? Or is the allied parent psychologically um, abusing the child? So the reality is simply parent, child, parent. Now, this particular diagram shows both the persecutory delusion diagnosis and the factitious disorder diagnosis off of the transgenerational trauma. So the persecutory delusion diagnosis is that victimized child from the trauma of the past to the current situation, when that's not true. It's just reality is just parent, child, parent. But we've got this victimized label in there. That's the persecutory delusion, creating that belief system in the child, shared induced persecutory delusion. And the all the roles are false. There is no victimized child. That's false. There is no abusive parent. The targeted parent is normal range. Parenting practices rating scale. Targeted parent's normal. That's a false display, or that's a false characterization. And there's no protective parent in this situation because there's no abuse going on. So that false displays, that false pattern, is the factitious disorder. So this shows the factitious attachment pathology and the persecutory delusion of everybody. Now, as we're assessing as a mental health professional, we're not just looking again for symptoms, we're looking for the pattern. And so, what we'll see in this pattern is a feature on all three of those roles. First, with the abusive parent, there will be allegations, but no substance. That when you actually start to look at what is abusive or what the allegation is, there's no there. You ask the child. So, the child says, "Oh, my mom is abusive." And you say, "What was she doing?" He says, she didn't take me to McDonald's when I wanted to go. Wait a minute. That's not abusive range. Okay. So there's no there to that because it's a false factitious attachment pathology. Then with the allegations from the child, there's no specifics. Again, that's you ask the child and it's vague kind of things, and it's not like I'm being beaten with electrical cords. It's like it's vague stuff. That's another symptom feature of this being a factitious, a false pattern that we're looking at. One of the key ones, though, and clear ones, though, is the protective parent role, because the pathological parent needs that role. That's part of their corrective change uh, to the trauma reenactment that they went through, their own trauma patterns. And as they're reenacting it, they correct or change features to the reenactment. Two in particular. One is that in their original trauma, they didn't have anybody to protect them. In this reenactment, the child has a protective parent. And so that protective parent role is critical for the allied parent to manage their reactivated anxiety. So their anxiety comes up, but they're in a protective parent role for the child. And so they're able to manage their anxiety. So that you'll see that very prominent. The other corrective thing that happens with this is empowering the child to reject the parent. So that you will see them really forcefully maintaining that we should empower the child to reject the other parent. because in their original trauma experience, they were not empowered. They were vulnerable and they were a victim. And so in this reenactment, now they are creating the empowered child who can reject the supposedly abusive parent. And that, again, helps them manage and regulate their anxiety. So on this particular pattern, that protective parent role, once we kind of say there's no there, you can look at that protective parent role and you will see it just locked in. And they will not move off of their need to protect the child even if there's no need. Contrary evidence, they will hold on to that. And then empowering the child. We need to listen to the child. We need to listen to the child. Yeah. So then the family systems pathology. Now, this family systems is one of the four main schools of psychotherapy. So there's psychoanalytic, cognitive behavioral, humanistic existential, and family systems. Family systems deals with families, so this is the one we should be applying. Within the family systems, the pathology is a cross generational coalition of the child with the allied parent against the targeted parent. Uh, so, uh, yeah. Let's find my spot. There we go. Cross generational coalition. So, within family systems, the description is that the child is being triangulated into the spousal conflict through the formation of an enmeshed cross generational coalition with the allied parent against the targeted parent, resulting in an emotional cutoff in the child's attachment bond to the targeted parent. So you can see the triangle there, right there from Minuchin's diagram. Um, it's clear the father and the son are in a coalition against the mother. And the so the top there, the father and the son, that's the enmeshed cross generational coalition. Then notice what happens. That top layer is in the hierarchy is the parent hierarchy level. The lower level is the child hierarchy level. And what's happened here, you can see, is that the coalition or the alliance between the father and the son has elevated the son up in the hierarchy above his mother. So now that son is empowered to judge the mother, the parent, as if the mother was the child and the child was the parent. That's your inverted hierarchy there. And then, and so that's a critical symptom that you'll see with it, part of this pattern. So when you're talking, or when a mental health person is talking with the family, looking at this, a couple features you'll notice about the cross generational coalition. One that's very clear is the inverted hierarchy. So you'll have a child, and you're looking at the directionality of the judgment. So is the child judging from above, or is the child in an appropriate hierarchy expressing grievances from below? I don't get to play enough video games and my bedtime is too early and stuff. But is the child acknowledging that they are lower in the hierarchy and that the parent is the authority, the mother in this diagram? Or is it flipped and the child feels entitled to judge the parent as if the adequacy of the targeted parent, as if the parent were the child and the child were the parent? So that's a critical symptom feature to note as the assessment. The other thing you'll see on the father-son alliance up there, that mesh cross-generational coalition, is that it's a two-step process. So the allied parent will first support the child and empower the child's ability to reject or criticize the other parent. And they'll do this by eliciting a criticism from the child through like directive questioning or motivated questioning. So, how are things going? What's going on? The moment they get a criticism, they will come to support it and say, "Oh, you poor thing." They'll offer nurture. They'll be so wonderful and supportive. That way, empowering the child's ability in the coalition or in the hierarchy to judge the other parent, giving them their power and authority, But for all the world, it will look, I'm just supporting my child. It's not me, it's the child. So that's where you get the empowering the child and the role reversal. It's not me, it's the child who is part of that coalition thing. It's basically they're creating that little ventriloquist puppet. And the moment they get the child in their coalition saying what they want the child is saying through the various manipulative tactics, then they can just put the child out front and let the child talk to everybody. And they say, oh, it's not me, it's the child who doesn't want to be with the parent. And, we need to listen to what the child says. So that's a feature of um, the cross-generational coalition. So here's Chloe Madanis, Big Kahuna and Strategic Family Systems, talking about the cross-generational coalition. So cross-generational coalitions take different forms in different families. And these alliances are most often covert and are rarely expressed verbally. They involve painful conflicts that continue for years. Sometimes cross generational coalitions are overt. The wife might confide her marital problems to her child and in this way antagonize the child against the father. The child may feel conflicted as a result, suffering because his or her loyalties are divided. That is exactly what's happening in the family courts. There it is. Family systems. The moment we stop making up pathology and start applying real knowledge, we have like reenactment narratives, we have cross generational coalitions, and we have a description. We know in the real world of psychology exactly what this pathology is. Problem is, forensic psychologists don't know any of this. They don't apply any of this. They give themselves permission to just make stuff up. And so we need to get rid of forensic psychology. We need to get clinical psychology back, and we need to do a proper risk assessment for child abuse to return an accurate diagnosis on the pathology in the family courts. So here's from Stone, Bueller, and Barber around the issue of psychological control. Now, I put the citation down at the bottom for a couple of reasons. One is to note just the title, Interparental Conflict and Parental Psychological Control in Youth Problems. That's directly relevant to what we're talking about here. And it's in a book from Barber as the editor, Intrusive Parenting, How Psychological Control Affects Children and Adolescents. You think that would be like a valuable book for all these mental health people to be reading? I think so. And it's published by the American Psychological Association. So there's no doubt or controversy about any of this. So parents, stop using new made-up pathology things. Use psychological control. Ground yourself in real knowledge. It's not, brainwashing. It's psychological control. There's lots of research on it. We know what it is and how it happens. And so, but here's what the Stone, Bueller, and Barber say. The concept of triangles describes the way any three people relate to each other and involve others in emotional issues between them. Bowen, Family Systems. In the anxiety-filled environment of conflict, a third person is triangulated, either temporarily or permanently, to ease the anxious feelings of the conflicting partners. This is anxiety. It's the allied parent is doing a lot of anxiety management. By default, that third person is exposed to an anxiety-provoking and disturbing environment. For example, a child might become the scapegoat or focus of attention. That's what we got here. Thereby transferring the tension from the marital dyad to the parent-child dyad. Oh my goodness, that's exactly what we have. Unresolved tension in the marital relationship might spill over to the parent-child relationship through parents' use of psychological control as a way of securing and maintaining a strong emotional alliance and level of support from the child. Exactly what's going on in the family court. As a consequence, the triangulated youth might feel pressured or obliged to listen to or agree with one of the parents' complaints against the other. The resulting enmeshment and cross-generational coalition would exemplify parents' use of psychological control to coerce and maintain a parent-youth emotional alliance against the other parent. There you have it. There's your description right there from Stone, Bueller, and Barber using family systems approach or constructs. That's what's happening in the family courts. It's published in a book published by the American Psychological Association on psychological control of children. This is established knowledge. This is not something new. Any way you turn to look at this pathology, you're going to be seeing the same thing. You're going to be seeing something there because there is something there. So now let's talk about the personality disorder patterns associated with that. And these are narcissistic, borderline, dark personality pathology. That's what we have in the family courts. Narcissistic and borderline are diagnostic categories of personality pathology. Dark personalities are identified in the research literature. They're not diagnostic patterns, they're research identified patterns. So if you want to know more about the dark personalities and delusional disorders in the family courts, Melanie Greenham wrote an article I'm second author on. It's up on ResearchGate. Dark Personalities and Induced Delusional Disorder, Part 1, a couple other parts. Solving the Gordian Knot of Conflict in the Family and Domestic Violence Courts. So in this article, we'll describe the pathology, the dark personality is collapse into delusions, and how that takes place. So for more information, you can go up on ResearchGate and get that information. And so we know for a fact that narcissistic personality pathology collapses into delusional thought disorders, paranoia when under stress. So, under conditions of unrelieved adversity and failure, the divorce, narcissists may decompensate into paranoid disorders. Owing to their excessive use of fantasy mechanisms, they are disposed to misinterpret events and to construct delusional beliefs. Among narcissists, delusions often take form after a serious challenge or setback. Divorce has upset their image of superiority and omnipotence. Delusional systems may also develop as a result of having felt betrayed and humiliated. Divorce. Here we may see the rapid unfolding of persecutory delusions and an arrogant grandiosity characterized by verbal attacks and bombast. So we know for a fact, Theodore Milan, Grand High Kahuna personality disorders, talking about personalities, not family court stuff. We know for a fact narcissistic personality pathology decompensates into delusions, persecutory delusions under stress. Divorce is stress. We're going to see it. We see it's in the family courts. There's no way parents put their children through this type of conflict if they have empathy for their child. We have absence of empathy by a parent, and that's a hallmark of narcissistic pathology. So we're going to get the persecutory delusions here. From Barno et al., relative to the borderline pathology. In conclusion, we therefore suggest that it is not a cognitive developmental deficit, but rather a tendency to construe interpersonal relationships as malevolent that characterize borderline personality disorder, and that this may be shared with certain psychotic disorders. Malevolent, psychotic disorder, that's a persecutory delusion. Notice the title, Borderline Personality Disorder and Psychosis. Okay, so we know narcissists and borderlines will collapse into persecutory delusions when under stress. The dark personalities were first identified the dark triad. So first cited by Paulhus and Williams, the dark triad refers to a set of three distinct but related antisocial personality traits. Machiavellianism, they are extremely manipulative. Narcissism and psychopathy. Wow, a narcissist, a psychopath, and extremely manipulative. That's a very difficult human being. Each of the dark triad traits is associated with feelings of superiority and privilege. This, coupled with a lack of remorse and empathy, often leads individuals high in these socially malevolent traits to exploit others, like the child, for their own personal gain. So there's three types of dark personalities. The first is the dark triad. That's narcissistic, psychopathic, and extremely high manipulation. The second is the vulnerable dark triad. That's vulnerable narcissism. The dark triad is grandiose narcissism. The vulnerable narcissist is, oh, poor me, and everybody's paying attention to me because of poor me. That's the vulnerable narcissism. And then borderline characteristics and extremely manipulative. And then the dark tetrad is you add sadism to the dark triad. Yikes. Okay, so the dark tetrad is narcissistic, psychopathic, highly manipulative, and sadistic. That is as bad as a person pathology can get. That's the most dangerous human on the planet. And they're in the family courts, undiagnosed, untreated, uninterfered with. They're just doing whatever they want to do, manipulating the courts, manipulating the situation, for spousal abuse, for child abuse, exploiting the child, and no one's stopping them because no one's dealing with any of this. And so we have dark personalities in the family courts. One of the associated features of dark personalities, that's part of the pattern, is virtuous victim signaling. So from Oak et al., effective altruism requires the ability to differentiate between false and true victims. Credulous acceptance of all virtuous victim signals as genuine can also enable and reward fraudulent claims, particularly by those with antisocial personality traits. The findings of this study support our hypothesis that virtuous victim signaling is more frequently displayed by dark triad personalities. So what's happening in the courts right now is we're getting the credulous acceptance, of all virtuous victim signals as genuine. So all false allegations, and we're just giving them like we believe them as if they're true, which is going to reward fraudulent claims from these antisocial personality parents. And so we need to get in there and differentiate which are authentic child protection concerns and which are just manipulative by these pathological parents. And again, notice the Journal of Personality and Social Psychology. This is not from these forensic journals. This is actually from the real world of real knowledge. So now let's talk about the attachment patterns that are involved here. And with the attachment patterns, it's a factitious attachment pathology. It's not real. It's not genuine. It's not authentic. And the way you can tell is because the attachment system is a goal-corrected motivational system. And a motivational system has direction to it. It moves in a particular, it has like a vector associated with it. It moves in a particular direction. And it always moves in the direction of bonding to a parent because the attachment system evolved within the context of predators. Predators are eating children. And so children who don't bond to a parent are become food, and genes are eliminated from the gene pool. So over the millions of years of this selective predation of children, a very strong and powerful motivational system developed within children to bond to a parent. And it's a specific person, my mother, my father, not just any old adult, because any old adult won't protect you. Only my mother, my father will protect me from the predator. So it's very specific, and it's very strong, and it's very directional. It's a goal corrected. If it meets a barrier to bonding, it will maintain the goal, but change how it tries to bond. Those are the various insecure attachment strategies, but it will always maintain the goal because there's a predator. If any child who rejected a parent, even a bad parent, gets eaten by predators. So their genes are eliminated from the gene pool. Now, if you have a bad parent, that's going to expose you to the predator even more fully. Holy cow, my parents like not paying attention, and they're a bad parent. So now, if I say, "Well, you're a bad parent, I'm going to reject you," I'm definitely getting eaten by a parent because they're not protecting me, and I've rejected them, and I'm dead, and my genes are gone from the gene pool. So that motivation does not exist in children to say, "Oh, you're a bad parent." Inverted hierarchy. You're a bad parent, so I'm going to reject you and get eaten by a predator. No, they're not, because they got the alive parent coming in to support them and take them. Okay, so it's all these other patterns come into play. But what happens with a bad parent and attachment? The child is more strongly motivated to bond to the problem parent, because at least then maybe they'll get protection from the problematic parent if they can find a way to get that parent involved with them. And so problematic parenting produces what's called an insecure attachment that more strongly motivates the child to bond to the parent. Primary motivation system, we're looking at directions of what's being motivated towards. In this pathology, we have an irrational display of an attachment system. The child is rejecting a parent to go be with predators. That never happens. Oh, because they're not. They have this alive parent who's coming in to rescue them and be the protective parent and all the manipulative stuff. But that's not how the attachment system works. It never seeks to reject. It always seeks to bond. And so it's a false. Yeah. And the bumpy thing on the parents there, it's like, yeah, even bumpy parents, even problematic parents, this child is still motivated to bond to that parent. In addition, what I didn't show is all the bumpiness of the child that's created from bonding to a bumpy parent. That's a good thing. Tronick talks about that being a good thing. That because as we develop these breach and repair, Tronick calls them mismatch and repair. So as we develop these breach and repair sequences over the course of time, we develop thickness in the relationship. We develop the ability to handle bumpy things without falling apart and collapsing. It gives us resilience to handle life's challenges when we've been through these minor challenges and been able to fix them and repair them. If we've never had that, we'll be like the King of France or something, Louis the 14th will be like a small child, unable to handle any sort of stress without collapsing, because we've never had those breach and repair sequences. So actually kind of being a little bumpy, it gets us through life a whole lot better. And so that's a good thing. So here's from Tronick and Gold regarding this. Repair is where the action is. We came to recognize that repair is the crux of human interactions. Repair leads to feeling of pleasure, trust, and security. The implicit knowledge that I can overcome problems. Furthermore, repair teaches a critical life lesson that negative feelings that arise from a mismatch can be changed into positive feelings when two people subsequently achieve a match. One does not have to get stuck in a negative feeling state. Now, Tronick and Gold refer to the good, the bad, and the ugly. And so the good is the just general mismatch and repair, breach and repair sequences. So a little empathic failures, a little conflict, and we repair it again, another breach, and we repair it again. Those everyday sort of breach and repair sequences are the good. The bad is when you get a breach that isn't repaired. Okay, that's like the still face studies. That's a bad kind of thing. The ugly is to leave it unrepaired. The worst possible thing we can do is leave a breached attachment bond unrepaired. And yet, that's exactly what's happening in the family courts. And not only is it happening, I read mental health people actually recommending that we leave the breach attachment bond unrepaired. The worst possible thing to do. And I'm reading mental health people recommending we do that because of the level of their ignorance. And in order to recognize a false attachment pathology, you have to know what real attachment pathology looks like. Otherwise, you're going to believe the mimic, the false display, as if it's real, and you're going to become a participant in the child abuse and a participant in the spousal abuse because of your ignorance and because you misdiagnosed the pathology. And so, this pathology, the shared persecutory delusion, is if we misdiagnose it, then we become part of the shared delusion. We become part of the pathology. And when the pathology is child abuse, we become part of the child abuse. So it is really, really critical that we get an accurate diagnosis on this pathology. So the pathology in the family courts is a false, factitious, artificially created attachment pathology imposed on the child for secondary gain to the allied narcissistic borderline dark personality parent. And it is FDIA, a factitious disorder imposed on another. It is also a shared persecutory delusion. It is also child psychological abuse. So the diagnostic criteria are not the pattern. The criteria are just a way to identify it quickly and parsimoniously, least number of symptoms needed. And so I think of diagnosis like identifying the puzzle. We got a pathology. We got a puzzle. Which puzzle is it? Is it? Am I going to do my treatment for the autism puzzle or for the trauma puzzle or the eating disorder puzzle? So the trauma puzzle we have here is the puzzle Cats in the Garden, and it will always have three pieces. So if you have these three pieces, or if those three pieces are present, the puzzle diagnosis is going to be Cats in the Garden. However, the puzzle is not Cats in the Garden because of three pieces. It's Cats in the Garden because the entire picture shows cats in a garden. There are flowers, a watering can, birds, a wheelbarrow, and 5 cats, and that makes the entire picture. And so its diagnosis isn't simply about the criteria. It's about, yes, the criteria, but you're also going to see all the fulsome symptoms of and no matter which way you turn it, you're going to be looking at the same coherent thing. So the diagnostic criteria are the few spots, the few stars in the constellation that quickly tell that it's the puzzle Cats in the Garden rather than horses in the meadow. However, the diagnosis involves seeing the entire picture of 5 cats playing in the garden. And there'll be birds over here. There'll be a cross-generational coalition over here. There'll be a delusional thought disorder if you look here. There'll be an inverted hierarchy over here. You'll see all the display of the picture. That's what makes it Cats in the Garden. Now, it meets diagnostic criteria for delusional thought disorder. It meets diagnostic criteria for factitious disorder. Both of those would be the diagnosis of child psychological abuse. So the patterns of pathology for the family courts, it's a trauma pathology. You're going to get transgenerational transmission of trauma. And if you look at that from that perspective, you're going to see the whole reenactment narrative. There's going to be diagnostic patterns. If you look, you're going to see the persecutory delusion. That's the victimized child and the transgeneration. But if you look, it's going to meet diagnostic criteria for delusional thought disorder. You're going to find a factitious attachment pathology. So you're going to get that diagnostic pathology. If you look family systems, you're going to see the cross-generational coalition and the empowerment of the child and the role reversal. It's not me, it's you. You're going to see the inverted hierarchy. Personality disorder pathology, you're going to see the absence of empathy. That's a capacity for cruelty. They deserve to be suffer. That's going to be a theme coming out of the pathology. The virtuous victim presentation, if you're into the darks. If you hear manipulation, if manipulation moves up on the potential symptom feature, if that you toss that on the table, somehow, somewhere, think dark personalities. That becomes the differential on Machiavellian levels of manipulation. Then you got the attachment pathology, a factitious attachment pathology imposed on the child for secondary gain of manipulating the court's decisions around child custody and to meet the pathological parent's own emotional and psychological needs, classically known as Munchausen by proxy, factitious disorder imposed on another for secondary gain to the parent. And so you're going to see all of it in its many directions. Now, what I did was I kind of took all of these patterns, and I identified 3 symptom features that will always be present with this particular pathology. These are the symptoms that will diagnose or identify the constellation of, court-involved pathology. And they are, first, attachment suppression towards a normal range parent. That never happens, goal corrected. So that's your factitious attachment pathology. 5, narcissistic traits or phobic fear of the parent displayed by the child. That's your personality disorder pathology. That I call those the psychological fingerprints of control by a narcissistic borderline dark parent. That you can't psychologically control a child without leaving fingerprints of that control on the child. And so diagnostic indicator 2 is the fingerprints of control. And then the third is a persecutory delusion displayed by the child. There's your diagnostic criteria, and there's your transgenerational trauma, the victimized child role, persecutory delusion. So if you've got all 3 of those, a factitious attachment pathology, a persecutory delusion, and narcissism, there's only one thing that this is. So this is cats in the garden. This is the pathology that I describe in Foundations. And then if you want to see all the other stars around the constellation to make the picture, there's your 12 associated clinical signs. So Greenham, Childress, and Pruder, looking at Dorsey's CRM data, 46 court-involved families, 45 of them had 8 or more of the 12 ACS. So those stars are present. You may not always see them because they're kind of faint, but those stars are present. Good clear night, you'll see them. At least 8. All 46 families had 5 or more. So they're present. And then if you want more information about the pathology, about the risk assessments, about mental health assessment of the pathology, for attorneys trying to make an argument to get a clinical diagnostic assessment, I have a lot more information available up on my consulting website. For the mental health section, I have the diagnostic checklist as well. That'll include the 12 associated clinical signs. I think that should be done routinely, as well as a parenting practices rating scale to document that the targeted parent is normal range or abusive range. But let's get that documented in somehow so we can stop fighting about it. If they're normal range, then the child shouldn't be rejecting that parent. If they're a normal range parent, we should see different symptoms. We're looking at factitious attachment pathology. So diagnostic checklist and parenting practices rating scale is an assessment protocol that will return an accurate diagnosis 100% of the time. If the symptoms aren't present, that's something else. But if these symptoms are present, diagnostic checklist, and you got a normal range parent, there's only one explanation. And then there's the outcome measure of a parent-child relationship rating scale. Ratings of the child daily by the targeted parent on a 1 to 7 Likert scale on affection, cooperation, social involvement, sent to the therapist, and that serves as your outcome measure for the treatment of the pathology. And so with that, I'm going to head off to my Sunday and return to life. Good luck to everybody out there, and we'll talk to you next week.